Stroke or paralysis is a medical emergency. It can occur due to rupture or occlusion of one of the major blood vessels supplying the brain. Patients who have advanced age, patients with high blood pressure or uncontrolled diabetes or heart disease are at a higher risk of stroke. Patients with stronger family history have a higher risk of stroke. Stroke can be identified in patients as sudden onset of weakness of hand or leg, patients with deviation of face to one side, patients who can have difficulty in talking. Some of the patients can present with coma or seizures or visual disturbances. Help the stroke patient by recognizing their clinical symptoms and call for emergency medical help. Time of onset of stroke is very important as it determines the treatment. Just check whether the patient is conscious and responding or not. Ask the patient to make a smile and see for facial deviation. Ask the patient to keep both the hands in neutral position like this for at least 10 seconds and just check if there is any hand deviation. Ask the patient to talk and make some meaningful conversation. If any one of these is abnormal, then there is a high chance that the patient is having stroke and emergency medical help should be activated. In stroke, every minute matters as around 1.9 million neurons die every minute after stroke. Once symptoms are identified, patient should be shifted to a safer position, avoid risk of contact with any sharp objects, check for consciousness and breathing pattern, and patient should be shifted immediately to the nearest stroke ready hospital. Remember, the first 4.5 hours after acute stroke is called golden hour, where the advanced treatment options can minimize the disability after stroke. Patients must be shifted immediately after identification of stroke symptom to the nearest stroke ready hospital. Comprehensive stroke care centers have the facility to do clot busting medication and also to do angioplasty and clot retrieval of the blood vessels of the brain to minimize the stroke disability. Remember, time is brain and we need to act fast.